Girls, another video to keep us beautiful and youthful. This video is going to be about how to firm up the eyelids and the lower lids, how to prevent more sagging. And it's a unique technique that I have done it for many years. The secret is out. I have not released the secret, so it's very important that you watch this video because you won't see anything like that on YouTube. And so we're going to firm up the upper lid and the lower lid. Those two areas deflates, wrinkles, and loose lipids. So I'll see you in a few minutes, my girls. Okay, hello my lovely friends on YouTube. Clarissa here. I am back with another video, and this video is going to be about how to prevent more sagging of the upper eyelids and lower eyelids in a mature woman. And actually you could reverse some of the damage by doing this special technique that had performed on me and my patients for many years. So stay tuned, girls. Okay, so but first I want to send you a big hug of gratitude and thank you for your beautiful comments. I don't take it for granted. Like I said, I read the comments. I have been busy this week. I haven't send you back replies, but like I said, I read the comments. I take it to heart with a lot of gratitude. Thank you, girls. Don't forget to thumbs up this video, like the video. Yeah, of course, thumbs like the video, share the video, and this video needs to really be shared by other people because it has very important information. And the more you like my video, the more censorship we will fight against this oppression of censorship that shouldn't be happening. But let's start the video. Okay, so I'm going to show you an isometric technique, but also another technique that is not a facial exercise. It is a technique that will help to stimulate blood flow, and also it will firm up the both areas of the upper and the lower lid. But first we're going to talk about the importance of nutrients to maintain the skin rejuvenated. I have many people asking me, how long should I take vitamins? Okay, it's like saying, how long should I eat? How long should I consume food? When it comes to vitamins, vitamins are also food for your body, nutrients for your body that should be taken for the rest of your life. And the amount of nutrients should increase as you age. It shouldn't be just a basic formulation. If you start taking supplementations and you have never taken in your life, let's suppose you start taking B complex or multivitamins or multi-minerals, etc. One bottle, it's not going to do a extreme transformation. You will feel somehow an improvement, but in order to see a complete transformation, you have to take it on an ongoing basis. If you just take one bottle of supplementation and then you said, oh, you know, I have seen some results, but not really results that I'm impressed with it. It's because the body had aged, you had lost nutrients, and you need to replace those nutrients. Otherwise, you're not going to see the 100% results. Nutrients, food, good food, organic food, you need to put in your system. and not just for a period of time. It has to be for the rest of your life. And so another question that people ask me is, how long should I do facial workouts? Okay, the same thing. You had grown older, we had grown older, we are mature people, and the skin is not the same as the 20. The skin is constantly sagging, so facial workouts needs to be done for the rest of your life. And start with 30 repetitions, increase to 50, then 100. The same thing with the body workouts. Now, tonight we're going to concentrate in the eye area, the upper and the lower lid. And supplementations that you need to take it is lipids, fish oils, ceramides, anything that has lipids, because this area right here has less lipids than the rest of your face. Another really thin area with very little lipids is your neck area, your décolleté area. And so now I'm going to teach you a technique for the eyes. And so what you're going to do is place these two fingers right here, okay? And then what you're going to do is close your eyes. It's going to help the upper lid. I'll show you another one for the lower lip and for the sunken temples right here, because this area right here will sink in, and so I'm going to show you a couple of techniques. Okay, so what you're going to do is put these fingers right here and then try to close your eyes with resistance, and place the tongue on the roof of your mouth and try to smile. Okay, let's place the tongue in the roof of our mouth and try to smile and close the eyes at the same time and hold it. When you are smiling and closing your eyes, hold with resistance. When you put gentle your fingers right here, you see this area is working. The whole upper lid is working, okay? The tone on the upper, the tone on the roof of your mouth. Place your fingers right here. Try to smile when your tongue is on the roof of your mouth. Close your eyes and hold it. Take a deep breath. Say, girls, the exercise that I just showed you looks simple, but it's very, very effective to create volume in orbicularis oculi muscle. And so the more you do it, the more results you will see, because it's affecting the upper lid, and we want to lift that. We want to make that muscle stronger and with volume in order to lift and prevent more sagging. Another one that I'm going to show you, it is placing your fingers right here, right? And then you're going to the same thing. Put your tongue on your roof of your mouth, and then try to smile and look up, okay? And when you try to smile and look up, hold it with resistance. Okay, let's place the tongue in the roof of our mouth and look up. Try to smile. and you will see that this area is working to lift the upper lid. Okay, sweet girls, the other exercise is for the lower part of your eye, for the temples. The muscle that is around the temples has the tendency to sink in and also create those wrinkles right here. And so this exercise, like I said, will create volume in your auricularis oculi, because the more resistance you put and the more repetitions you apply, it's going to make a difference. Okay, so let's place the tone on the roof of our mouth. Try to smile and close your eyes. So when you have the tone on the roof of your mouth and you're trying to smile and close your eyes, hold it with resistance. Take a deep breath. Okay, this exercise is a little stronger. It may give you a headache at first, but once you get used to it, you'll be fine. Start with 30 and then increase 50 and then 100. And so it's very effective, because when you're placing your fingers over here, you feel that the muscle is working. It's gonna create volume to prevent more sinking of the temple area. Excuse me. So those are the techniques that I am showing you to firm up the upper and the lower part of your eye. So now I'm going to show you a very unique procedure or technique. And girls, this is very unusual. So for the girls that don't like to do this and you think it's crazy, don't do it. Don't you know, try to send nasty messages or anything like that. Okay, so you're going to go to the hardware store and find the most tiny nails that you can find. Okay, so we're going to use 3 of them. Okay, this is similar as micro needling, but because they are a little thicker, it's going to be a little more gentle, but it's going to create blood flow to increase the elasticity of the area of the upper and lower lid. Okay, so I have 3 of them right here. They're very, very tiny, and it's not going to create any type of injury. This is the purpose of creating blood flow, oxygenation, to maintain the elasticity of this area that is very, very delicate and thin. Okay, so you're going to apply a little bit of your favorite oil. I like to apply emo oil or abyssinian oil or jojoba oil. And so this is a demonstration only. So what you're going to do is, I have 3 tiny little nails, and the ends of the nails are not sharp. They are just enough to stimulate blood flow to increase the elasticity. So what you're going to do is, I'm going to grab this little mirror here. Okay, so what you're going to do is go like this. And lower part, and then And then you're going to go up like that, up like that, up, up. And so remember, you started in this direction like that. So you started from higher, lower, and lower. And then the other one, you go up like that, up like that, up like that. And then the lower part, the same technique. So you're going to go higher there, lower, lower, and then up, 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 up. So you do the same thing with the other eye. You could also use, if you don't have the nails, you could use, this is the hand needles to sew, but what this is different type of and sizes of needles. You're going to find the thicker size of needle that does not you know, pinch your eye or anything, that does not create any type of injury. So the thicker needle for sewing, hand sewing, is almost the same width of the tiny little nail. And so if you don't have nails, you could do that using the needle. So you could use the hand sewing nail, like I mentioned a few minutes ago, is the same width as the nail that I just showed you a few minutes ago. And this is not a sharp end or anything like that. This is just with the purpose to bring the good recycling of the blood, to create oxygenation, to maintain the area, the upper area and the lower area of your eye. So the same procedure as you did with the nail, you go like this. Always start from the highest point and then go up. And you don't have to press it hard, okay? Just enough to create some blood stimulation. The same thing with the lower. You started from the higher point and then go down. Just enough to feel a little bit of pain, that's all. My girls, make sure you clean your skin very well before you do this procedure. And then apply a thin oil, the oils that I mentioned a few minutes ago, around the upper lid and lower lid. Make sure the oil is a thin oil. Then you do the procedure. So after you're done with the procedure, take some kind of a toner or witch hazel and wipe the residue oil that you had applied prior. So make sure the area is completely clean, because we're going to be using retinoic acid, which is the retin-A. You could use any type of retin-A, and this is the stronger formula, 0.1%. If you have a 0.5, it's fine, but I cannot give you a link of these because when I go to Europe for training every year or every 2 years, Last time I got about 20 of them for my personal use and for my patients. But you could use any type of retin-A. So apply around the area of your eye, the upper and the lower lid, and wait about 30 minutes, 30 to 40 minutes until the retin-A had neutralized and absorb good into this area right here. So it's going to absorb very good because you had done the procedure to stimulate you know, blood flow. And so after that, what you're going to do is apply this formula that has DME and apply in both areas, upper and lower lid. But make sure you had waited at least 30 minutes after you apply the retin-A. And so then you wait about 10 minutes to 15 minutes and apply your skin regimen. It's very, very effective, this technique and this treatment, and hopefully you like it and let me know the results. And when it comes, I think I mentioned at the beginning of the video, when it comes to treating your eyes, it's very important that you take you know, good quality essential oils, which provides you know, the good lipids, and also ceramides. And you could find it at the health food store or any store that sells nutritional supplementations or Whole Foods. The ceramides that I like is by Life Extension. I will put the link in the description box. And the essential oils also I will put, excuse me, the link in the description box. There's a particular essential fatty acids company that specializes in fish oils that I use, and so I will make sure I put the information in the description box. Bless, stay beautiful, and do this technique together, the isometric technique together with this procedure that I just showed you. That is so effective. I have done so many years and maintain my eye area practically you know, very lifted for my age, and so I'm not a young girl anymore. Yeah, I am 61, so next year I'll be 62, and the next year 63, 64, 65, and I want to maintain myself healthy, not just looking beautiful, but healthy. And so that way I enjoy life to the maximum. With a healthy body, with an unhealthy body, life could be miserable. Okay, girls, ciao, bye-bye now. You take care.